Crider Health Center has been serving the health needs of citizens since 1979. Our mission is to build resilience and promote health through community partnerships. We have expanded both our services and coverage area to become the most innovative, accessible, and proactive provider of health programs in the area. Many individuals with severe and persistent mental illness benefit each year from Crider Health Center. We offer dozens of programs targeted to children, adults, families, and communities. Many of Crider Health Center's programs extend outside of our clinics. For students and faculty of the Troy School District, partnering with Crider Health Center made sense and made a difference.
The need in the school district is huge for mental health services. We see so many students who struggle every day, and to know that we were going to have experts in the mental health field assist us with these students was a definite blessing when this partnership was formed between Crider Center and the school district, because we were finally able to start meeting some of those children's needs.
25 years ago, the Pinocchio program began with the goal to help children get a good start in school.
When she was young, she was very shy, to the point that even if we were at a family gathering and someone asked her, "Abby, how is preschool?" she would grab my leg and, "Oh, Mommy, you answer for me." And we thought, oh, she'll outgrow this. And then as we moved into our home and we started a brand new school, she lost both her grandmothers and her beloved pet died. When we met with her teacher for teacher conference, her teacher addressed the issue with us. It took a lot of encouragement to get her to join in a group activity, that she wouldn't raise her hand and participate. I think what really struck me as a wonderful part of the program was that it's okay to have all these feelings, to be sad, to be frustrated, to be angry, or to be nervous about starting a brand new school, getting used to all new friends. And they would help her deal with all these feelings and teach her skills and tools to use to help her want to join in and participate in class. I have a child that is very confident. She has this wonderful personality that has come out, a great sense of humor, where before she was kind of on the outside looking into all of that. And I really credit the Pinocchio program for bringing all those wonderful things out in her and helping our family to bring that out in her too. It was just a real plus, and we feel very blessed that we were able to participate in that program and grateful that it was there.
Another unique program to Crider Health Center is their crisis response team. When a crisis occurs within a community, many times people do not know whom to turn to for support and care.
Traumatic events can really have long-standing consequences for individuals if they're not addressed and treated properly. So this is a way of kind of preventing any future mental health issues down the road if we're able to, provide them the support that they need shortly after the incident or the trauma has occurred.
All of our family had thought we were dead. I think we were so devastated to what we saw. We didn't realize that we were going to have to leave. It was so sad. You're walking around and you're looking at homes, these beautiful antebellum homes that were there, that there's nothing left of, not even a brick, nothing. We were absolutely petrified. Didn't know what to expect, what to think. We had only the clothes on our back, which was covered in mud. And it was just very heartwarming to realize that these people just opened up everything to us. They helped us with every aspect, not just with counseling, but other needs, furniture, when we finally got our own place, and now we've become a family again, the way we used to be way back when, before the storm terrorized everybody. What they offer isn't just counseling and medical services, but it's the whole environment when you go there. even the office staff, even from the very first time I went in there to even now, how welcome they make you feel. And to me, it was like visiting with friends and family versus going into a medical office. And it was just that welcome feeling, that sense of security and comfort. I remember sitting and crying probably the first 2 or 3 visits with them, just to know that there were people out there that cared. You know, that really cared. I mean, it was, yes, maybe their job, but it was more than that. You know, they came in with hugs and warmth and caring that a job just doesn't cover. You know, much more than that. Much, much more than that.
Along with programs like the Crisis Response Team, Crider Health Center has always been a model in the state for innovative healthcare programs. Today, Crider has integrated its strong mental health services with primary and dental care. For the first time, the uninsured now have access to their total healthcare needs.
We had just moved up from Texas. We didn't have any insurance. I needed teeth pulled. My kids needed dental work done. My daughter had braces on for almost 2.5 years, that had not been properly taken care of. They was causing her a lot of pain, and she was really scared about coming.
I had a big fear. The dentist I had been to before, they're really rough with my teeth, but he wasn't rough, or he cares. He's not just here to do his job, he actually cares about his patients and their teeth.
We've, from the beginning, had a vision that we wanted to address the mental health needs of all of our communities in a holistic way. So we needed clinics right here in the community, and we're starting in Warrenton and in Winsville with primary health care and mental health care, and with dentistry in Washington along with our mental health care services. And over a period of time, we plan throughout our area, in all of our communities, we hope to have comprehensive primary health care, dental, and mental health care centers integrated together, one-stop shops.
Crider Health Center community support programs provide more intensive case management services than traditional outpatient clinics. The program is highly individualized. A Crider Center case manager makes house calls, visiting the individual in their home.
I was a real bad alcoholic. I needed help. I had an option, jail or here.
Each of our clients, they have an illness, and they have something that they try to overcome with every day that I couldn't even imagine.
But I've been kicked around a lot. I lost all my family,
If I look at any of my clients, I see a difference between where they were a year from now as to where they are now, and their clean time is substantial.
I try to do everything the right ways because I don't want to go down that road again.
Sebastian's behavior was very violent, very aggressive when he was younger, very difficult to focus. The doctor told us that he was bipolar, that he had ADHD. At that time, we were just without hope. We were told that what I wanted was not available. There were no services there. For so many years, we did not have faith in case managers before we met Crider. They helped us to develop a plan of care for Sebastian. And they asked us, what do you want to happen? What do you need? What do you need to make that happen? I began to see that they really did care about us, and for the first time, I trusted someone. I didn't have to rely on myself to try to find the answers. I knew what I wanted for this child, but I didn't know where to go to get it. They did. I think if the Crider Center had not been involved with us, I hate to say this, but I think Sebastian probably would have ended up in an institution. He was 14 years old at a Crider activity when he met his first friend. And it's really heartbreaking to know that your child is 14 when he gets his first friend. I think that Sebastian feels good about himself. He likes his role in life, and he knows that he is loved and that he's important. He's very kind, he's very gentle, he no longer is aggressive, and he just loves people. He loves to help people. And who could ask for a better child than that?
Thanks to the dozens of services offered by Crider Health Center, many children and adults in our community are living healthier, happier lives. With your help, we can achieve our vision of full, productive lives for everyone. Crider Health Center, building healthy individuals, families, and communities since 1979.
They are the experts.
They take very good care of us.
Crider really gave me a lot of hope.
This place has changed my life.
They did make a difference for us.
Crider Center always had our best interests at heart.
And they really do care about us.